So in this ESMO meeting, we present the data of KEYNOTE-585 study, investigated perioperative Pembrolizumab for locally advanced resectable gastric and GG cancer. In background, surgical resection and perioperative chemotherapy is a standard for such population globally, but survival outcome is not enough. So we want to combine anti-PD-1 therapy to improve outcome of such population. And this is a global randomized double-blinded placebo-controlled trial. And eligible patients should have a clinical T3 or higher primary region and regional with or without regional lymph node metastasis. In main cohort, backbone chemotherapy is a capecitabine 5-FU plus cisplatin, relatively old regimen, but this trial is based on planning in 2016, so it takes a long time before read out. The backbone chemotherapy is a doublet in this main cohort to enroll around 800 patients. A primary endpoint of this main cohort is a pathological complete response rate or PCR rate, event-free survival, EFS, and overall survival. There was a separate cohort to evaluate FLOT plus Pembrolizumab. Since again the trial was planned before pivotal 4 trial, so we want to assess the efficacy and the safety of FLOT plus PD-1 in this population. The sample size is around 200 patients. And as a result, preoperative chemotherapy showed a completion rate in more than 90% patient, and the surgery with curative intent was performed in around 85% patient. And then 75% patient underwent the additional adjuvant chemotherapy, and half of patient completed treatment. R0 rejection rate was 80% with Pembrolizumab in the main part, and 75% in the placebo. So there was a 5% difference, and there was no difference in FLOT cohort. And as a primary endpoint, pathological complete response rate showed a statistically significant improvement with Pembrolizumab plus chemotherapy versus placebo plus chemotherapy. Actual data was 12.9% with Pembrolizumab and 2% with placebo. So there was around 11% difference. And the EFS is the most important primary endpoint in this study, and it showed a separation after 10 months in Kaplan-Meier curve, and it showed a difference of the median EFS from the 25 months in control arm to 44 months in experimental arm. So there was around 20 months improvement. And also 3-year EFS rate showed a 10% difference, and the hazard ratio was 0.81. But the actual p-value was not significant because we already have 2 interim analysis to spend alpha L. So again, this is a very borderline result, but not statistically significant. And the overall survival is still immature, but showed a hazard ratio of 0.90. In subgroup analysis, the benefit was observed, especially in patients with MS and high population as expected. Also, exploratory analysis showed some enrichment benefit in CPS 10 or higher population. And this is an efficacy result, and no new safety finding or unexpected finding from the safety activity. So in summary, this KEYNOTE-585 showed improvement of PCR rate with the Pembrolizumab plus chemotherapy in locally advanced gastric and GG cancer, but the difference in EFS was not statistically significant. So we need additional research to apply the checkpoint inhibitor in perioperative setting. So actually in the same session, Matterhorn, another phase 3 trial was reported. So maybe next step is to wait EFS results from Matterhorn study.